Breaking news from Eli Lilly. Angelica Peebles is standing by with the details. Hi, Angelica.
Hey, Kelly. Well, it's good news this morning for Lilly. The company is saying that its weight loss pill met the company's goals in the first of 7 phase 3 trials. This one is with people with type 2 diabetes. Now, the pill, orforglipron, helped people lose almost 8% of their body weight at the highest dose. And that was at the high end of what Wall Street was expecting for this. And Lilly says that it looks like people hadn't plateaued when the trial wrapped at 40 weeks. So there could still be more weight loss there. A1C, or blood sugar levels, decreased by 1.5 points at the highest dose. Now, that's exactly what Lilly had guided, but it's lower than what analysts were projecting. They were looking for more like 2 points, so there might be a little disappointment there. And on the side effects, nausea, vomiting, all those GI side effects coming in line with JP Morgan's base case scenario, and 8% of people on the highest dose dropped out of the trial because of the side effects, meeting TD Cowen's expectations. And Lilly didn't see any liver issues. Remember, just the other day, liver toxicity tanked Pfizer's obesity pill. Now, Lilly plans to seek approval for obesity by the end of this year and diabetes next year. You can see that stack up about 11% and Novo down about 5% on the news. Guys?
Angelica, remind us, what's the status at this point of the oral weight loss drugs that are on the market?
So this would be the first small molecule pill for weight loss. And that small molecule is an important distinction because although there is an oral version of Wegovy from Novo Nordisk called Rybelsus, it's a peptide, and that's much more difficult to make. You need a lot of it. And small molecules, it's basically the pills that we all know, we think of, we have them in our medicine cabinets, and you can scale those much more quickly. So Lilly today saying that they're ready, they can ship this around the world, they can make this, and they would have a huge head start over everyone else in the space in terms of this small molecule. So this would be a very big deal for Eli Lilly.
That's weird. How does a peptide? I was hearing out of the corner of my ear. I was looking at something, but a peptide is in pill form, but it's not only hard to make.
Well, yeah.
But don't you digest it immediately when you take it? If it's a big molecule, I don't even understand how that would work.
Yeah, it's very difficult, and that's why Rybelsus, isn't as effective as the injectables. There's not a whole lot of uptake. It hasn't been a huge seller just because of all of those problems. And again, you need to make so much of it, so it's very prohibitive. I mean, you go and see Lilly where they're building their API facility for their injectable, and it's just a massive facility because you need so much space to make these. In small molecules, it's just so much easier, and so that's why people are very excited about this particular drug.
Wow! So whatever the active part of the molecule is, they got it, and everybody's going to try and do that. How'd they do that?
What do you mean specifically? So this is different.
For the small, it works as well as the injectable. They must have found exactly what's mediating the action, right? And it's in a much smaller form than a peptide.
Yes. So what's happening here, what is so exciting for Lilly is that they are trying, the goal here is to have something that's as effective as Wegovy. Of course, that's Novo's injectable. And they're not saying that this is going to be as effective as its Mounjaro and Zepbound. In fact, it's actually probably going to be much less effective. But the idea is that if it's a pill, it's better economics for Lilly to produce it, and it's easier for some people to take and to ship around the world. And so that's the proposition here.
Well, yeah, it's a holy grail. No one wants to stick needles in their stomach or whatever. Where do you?
Right. But a lot of people do. A lot of people are okay with it.
Not me.
And so that's the interesting thing here is, how many people are actually going to take this? And I think we have seen some more nuanced discussions around how many people actually want a pill versus an injectable.
Bad
but
enough that
we'll have to see how that plays out.